Good afternoon, and thanks for joining us for Armor Animal Health's video series, Have You Heard? My name is Leslie Gravatt, and I've been with Armor Animal Health for just over 9 years. I'm originally from Minnesota. Hold on one second. Excuse me. Where I've always had an interest in animals and ag. Growing up, I spent many weekends on my cousin's cow-calf operation, showing, and dog sports. Whew. Today we have Dr. Curt Vlietstra with us, a dairy professional service veterinarian with BI, to discuss on-farm culturing. Thanks for joining us, Dr. Curt.
Thank you, Leslie. Happy to be here.
Dr. Curt, could you please tell us a little bit about yourself?
Glad to. My name is Curt Vlietstra, and I'm a professional services veterinarian for Beringer Ingelheim. I've been working for BI for coming up on 5 years this summer. Prior to that, I practiced for about 13 and a half years in that I-29 dairy corridor over by Sioux Falls, or kind of where Minnesota, South Dakota, Iowa, and Nebraska all come together, and did primarily dairy and then some seasonal beef work, and after hours and on weekends, all creatures great and small. So I live in Waupun, Wisconsin with my wife and 3 teenage kids.
Thanks, Dr. Curt. It is great to see that we have so many tuning in today. For all those watching, we encourage you to ask questions in the comments section throughout the video. So it does look like we have Wyoming, and it's snowing in Wyoming right now. We have central Iowa joining us, and southern Wisconsin, where it is cloudy as well, at my house too. So with that, we do encourage you guys to ask questions, and in the Facebook comment section, feel free to type those in, and we'll be getting to those at the end of the video. And so we do know your time is valuable, so we'll get started. Mastitis is an ongoing battle in the dairy industry, and the consequences are costly. There is research that shows that just one single case of mastitis during the first 30 days in milk adds up to about $444. On-farm culturing is an effective way to manage mastitis while cutting costs and reducing antibiotic usage. Dr. Curt, for those not familiar with today's topic, what is on-farm culturing?
Yes, on-farm culturing mainly implies just a very, it's meant to be a quick and simple way for you to be able to identify, first of all, is there a mastitis pathogen involved in that case of mastitis that you're investigating, and then maybe is it something that needs to be treated? And so in general, on-farm culturings are the majority of farms that I've worked with that are interested in adopting on-farm culturing will look at it both in ways to reduce drug costs, reduce labor costs, reduce discarded milk, and more lately, a little bit more pressure to make good use of, or good decisions, good use of the antibiotics, judicious use of the antibiotics that we have. Because again, not all cases of mastitis need to be treated, and on-farm culturing is a really quick and relatively simple way of making those decisions.
Thanks very much. So what are some of the benefits that you've seen with farms that do on-farm culturing?
Yeah, so I guess to go into a little bit more detail of what I'd mentioned at the top there, number one is going to be a reduction of antibiotics used, the direct costs associated with using antibiotics when you reduce the number of cases that you treat. Judicious use of antibiotics, though, doesn't just mean using less antibiotics, it means using them appropriately when they need to be used, and justifying that use. And so certainly there are going to be cases of mastitis where the milk is abnormal, but we don't grow any bacteria. And if there's no bacteria, there's no need to spend the money, spend the time, pay your employees or pay yourself, throw away unnecessary milk, and then also potentially put your bulk tank at risk of a residue if there's no need to treat. So, I mean, that's going to be overall the first one. And then again, it's relatively quick, especially if you keep it simple. You get results very, very quickly. And a lot of times you can actually make the decision to treat or not treat before any antibiotics would have been used without that information.
So, Dr. Curt, when culturing, what would be the breakdown of results producers would maybe expect?
Yeah, again, it's going to vary a lot farm by farm. It's going to vary by management. It's going to vary by age of the cow, especially bedding type. But in general, if you go to a lot of meetings, they'll use this principle of a third, a third, a third. And when we say a third, a third, a third, that means about a third of the cases are going to be no growths, first of all, where there's no bacteria at all that are grown. And we can get into that if there are some questions to try to, we think we know why there's a lot of times no growth, but then another third are going to be what we call gram-positive bacteria. The most common types of gram-positive bacteria are staph and streps and related species to staph and streps. And then the other third would be gram-negative bacteria. And again, examples of two more common gram-negative bacteria would be E. coli and Klebsiella. So if you, again, that's going to be very typical of the results that you would expect to see from an on-farm culture lab. And when you look at reducing or not treating those third that don't grow anything, and then again, there's a lot of data that would support not needing to treat mild cases of gram-negative bacteria, because a lot of times they'll take care of themselves. You can reduce your mastitis treatment by over half by using on-farm culture.
Yeah, Dr. Curt, that definitely would be 1+ for doing on-farm cultures to help decrease that antibiotic usage. So when a producer's wanting and starting to culture, what supplies might they need?
Yeah, and it's good to talk about this up front, because I think a lot of times the thought of that's something that professional lab technicians need to do, or that's something that may, it's like this secret that, people need to be really, really sophisticated, need some high-end, very sophisticated equipment to be able to do. But in general, you need an incubator first and foremost, and that tends to be the most expensive thing, but it doesn't have to be. You don't have to go out and buy a university quality incubator, but you need an incubator that can control the temperature at a relatively stable temperature, right around our body temperature, the cow's body temperature. But then it's the supplies that you would need to collect the samples. So milk sample vials, sterile milk sample vials, a Sharpie to label, identify, don't make mistakes there. So identify the quarter, in addition to the cow's ID, and I like having the date just for some of those repeat cases. So milk sample vials and a Sharpie to be used where you collect the milk samples. And then once you get into the lab, you'll need swabs to be able to take an appropriate amount of milk out of that vial and swab it onto the culture plates. And then you obviously need the culture plates. And culture plates, there are a variety of places where you can get them. In general, the on-farm culture systems, the way they work is by having different types of selective media. And so selective media will only allow, or they'll select for certain types of bacteria to grow. So for example, one type of media will only grow gram-negative bacteria. One type of media will only grow gram-positive bacteria, and then there's media that will grow basically everything. And so that's how on-farm culture works. And again, you don't need a lot of supplies, just a handful of basics. It's not going to break the bank. And most of the time, if you, depending on how many cases of mastitis you usually have on a farm and how many cases you can stop treating with that information, the payoff of that equipment generally takes place in just a few months.
Yeah, so I know that picture that was just up there, and those were the plates from the Minnesota Easy Culture system, which is, like its name entails, fairly easy to use. But there are many other different plate systems out there. I'm sure that you, as well as myself, are familiar with Minnesota easy culture from being from the Midwest area.
Yep, they call it culture for a reason. So, and they, it's one that a lot of farms go with because they tend to provide resources that make training very simple. And with that, when you're talking about trying to set that up, the other things in addition to supplies that you need, physical supplies, are generally you need the right employees. You need somebody who's going to be diligent with cleanliness, a little bit detail oriented, maybe a little type A, and is going to be really good with recording the data and doing, again, almost getting frustrated. You don't want somebody to really get frustrated, but right on the edge of expecting perfection, even though we can't quite get there. Having a dedicated place to set up the culturing where you plate. You obviously, for an example, I've gone into some dairy offices where they have their mastitis lab right next to their cluster tester where they're drying down forage samples. And that's probably not ideal. You would expect to have a lot of contaminated samples. And then I think it's nice to have a dedicated refrigerator for those supplies as well, a little dorm fridge where everything is there. It's very easy to take inventory of what you have and what you need to reorder. So those are some other things that you would need.
So if a producer would like to get started with on-farm culturing, how would they even begin? Who should they reach out to?
Yeah, I mean, if your veterinarian that you work with is usually going to know a good deal about either how to do it or at least where to go to get the supplies, the resources. Some of the processors have field people who are well versed or maybe have seen other farms that do it and have maybe learned from some of their mistakes. And so that's who I would reach out to, whoever your veterinarian or whoever you work with for your milk quality supplies.
Thanks for that, Dr. Curt. As well as for veterinarian, your Armor veterinarian can also kind of help get that set up, or myself. So let's see here what type of questions we maybe have coming in. And it does look like we have a question about, does waiting 24 hours for culture results before deciding to treat a cow with antibiotics hurt the odds of that treatment success?
Yeah, good question. So I'll back up just a little bit and say that for the most part, for the bacteria that we can treat, you will have results in 24 hours, sometimes even less. I found when I was working with my lab in practice that if you would set up those milk samples in the afternoon, most of the time, if it was a bacteria that you could treat, you'd be able to identify growth the following morning. And so 24 hours would be about the longest that you would have to wait for some sort of guidance on whether or not you're going to treat or not treat. And so with that 24 hours, there are actually some very well-designed published studies that show that waiting is not going to affect the outcome. It's not going to, and that would say as long as the cow's not sick. So I'm used to grading mastitis in grade 1, 2, or 3. In those studies, typically the grade 1s and the grade 2s, or the mild and moderate cases of mastitis, there's no risk at all, no downside to waiting 24 hours. And all there is upside potential. Again, once you start treating a cow, you have to start throwing milk away. And you've got antibiotics in the milk and all those other things to worry about separating the cow. So waiting 24 hours is not going to cause any issues. And for those who are a little bit doubtful or skeptical of that, especially those of you that work with farms that have a couple of different shifts of milkers, or you've seen milkers come and go, it's very easy to accept the fact that there's at least 24 hours of variation in the ability from your most skilled to maybe your lesser aware milkers to be able to detect mastitis. And so if you can think about that a little bit, hopefully you have a little bit more comfort in waiting 24 hours or till the next day to initiate treatment.
Well, thank you very much. Another question here. is, what does the different grades of mastitis look like? I know you had mentioned grades 1, 2, and 3 are mild, moderate, severe.
Yeah.
Kind of when would be that kind of that highest level, that grade 3, that severe mastitis that we really do need to have quicker intervention?
Yeah, I guess, again, just to keep it simple, for me, a grade 1 is going to be when the milk is abnormal, but the udder is still relatively soft and the cow looks bright other than having junky milk. Grade 2 would be that next step where now you have abnormal milk and there's some redness or some swelling to at least 1/4 in the udder, some abnormalities there. That'd be a grade 2. And then grade 3 is when you, in addition to those other things, or maybe even though the udder maybe doesn't look bad, if it's a very acute aggressive case, you can have a sick cow, and that can range from droopy ears to a very weak appearance, depressed appetite, all those types of things. Anytime I see a cow with systemic signs, in addition to abnormal milk, there'll be a grade 3, and that's when you work with your veterinarian to have those, because a lot of those protocols will involve systemic antibiotics and either oral or IV fluid therapies and some other things like that.
So if you were doing on-farm culturing, how often should you be taking a sample and plating it and seeing what type of pathogen you have?
Again, the plates, there are some perishable expenses, but by and large, your incubator is the biggest expense. And so once you have that incubator purchased, you might as well use it. And so I'm a fan of culturing every case of clinical mastitis. And then once I'm done plating that, I'll as long as that sample is labeled well, I'll put it in the freezer, and then it's there in case I need to recheck the cow. We'll talk about validating your results here a little bit later, but I think every clinical case of mastitis should be treated. And then in addition, I've worked with a lot of farms where they'll use their monthly DHIA reports and find some of those high somatic cell count cows, maybe go out with a CMT paddle or other way to try to identify the high quarters and then sample some of those, even though the milk may not look abnormal, and do some treatments based on those results. So again, if you have the equipment there, if nothing else, it's good practice. Never miss an opportunity to get better and to keep those skills sharp. You don't want those plates to expire in the fridge. That's silly.
No.
Goes against my Dutch heritage. So.
Yeah, and kind of what I've learned too from working with the plates is the more time they can spend in the fridge versus sitting on the counter, longer they will last. So, if you take them out, you take out the number of plates that you're going to be using, and then you put the other ones kind of back in the fridge. I even like to store them in a Ziploc bag to help prevent kind of any other exposure to different environments.
Yeah, and those, again, you'll work with whoever you get the supplies from or whoever's helping you set up the lab. But I would agree, take out what you need, put everything back in the fridge, but usually want to let those plates warm up to close to room temperature before you start trying to write on the lid with a Sharpie or plating the milk onto a cold plate. You'll get better, more accurate results.
So kind of along the same lines of testing, should producers be running confirmatory tests, like they're sending samples to a diagnostic lab, even though they're doing the culturing on farm? And I guess if so, how often should they do that?
Yeah, so there's a couple of things that I recommend. One is anytime that advisor that you're working with gets a chance to look over your shoulder, pop open the door of the incubator and take a look, just to double check, have a second set of eyes on it, just saying, is what I'm seeing what you see? But in addition to that, sending samples off to a reference lab. And so there are different ones. There are state labs, there are private labs. And again, typically the people who help you set up your lab will be able to help out with what to do with those. So that's, again, a reason that I like to throw those samples back in the freezer. And in terms of how often, I think it's good to recheck some of the routine bugs. So something that looks like a very generic staph, strep, E. coli, get those checked, because hopefully those are the majority of what you have. if there's something that's very unusual in appearance, but especially if you have a very clean growth where there's not really much contamination, that's something worth sending off. And then if you have cows that you think you grew something that's very normal and straightforward, but the cows don't respond to treatment, I'll typically send off the original sample, and then I'll take a new sample and send them both off to compare. So different ways, and I like 10% is a good number. Roughly 10% of the samples that you do your own, send those off. But the more confidence you have, and if you keep getting confirmatory results from those reference labs, maybe less often. But at least when you get going, because in general, when I find farms that get excited about on-farm culture and then let it go over time, one of the main reasons is they lose faith in themselves to be doing things right, and they'll just quit. So when you get started, I think is a great time to do it maybe a little bit more frequently.
So one thing I guess that I have wondered too is, you're doing the on-farm culturing, so you're identifying, mastitis or non-mastitis cases in the cows. What benefit then would be running, quarterly bulk takes for the farm to assist with that process?
Yeah, and I think some of that is just to help you, the cows that get mastitis, anytime there's a change in what's normal is potentially cause for concern. So if you are seeing more cases of clinical mastitis, you'll have a flare-up and there's more cows in the hospital. Is what you're growing in those cows different than the proportion of those results that you would have normally when you're not having a big break? But in addition, is there something that's changed on your bulk tank culture? Are you seeing more gram negatives, coliforms? Are you seeing a spike in something unusual that may be, because some bugs are tough to grow in a non-farm lab, and doing a bulk tank culture can help cue you in on, hey, maybe I need to be sending a few more of these off to make sure it's not a mycoplasma or a prototheca or some of those bugs that really scare us.
I know I've seen quite a few people, sending in their quarterly bulk tanks to our lab and rather than doing culture, we do the PCR for either contagious or the contagious and environmental. But do you feel that either one would be kind of suit for doing those quarterly checks?
I think as long as you're aware of what tests are being done, so there's advantages to a PCR test in that they are significantly more sensitive. But the downside of that is if somebody's not used to looking at those, they see a report back with 30 different types of bacteria that are present on a PCR report, and they get scared. And so those tests, sometimes they'll find such low levels of bacteria that they aren't even really involved in mastitis, bugs that you don't even recognize the names of. So I think as long as you're aware of what type of test and not to overinterpret the results, but a PCR is great because they are so sensitive, and a negative PCR is really about as negative as you can get. But some of both, I think sending some samples off with your milk hauler every now and then to be able to get them tested at your processor, because they obviously care about the quality of your milk as well. And then in addition to bulk tank cultures, I think doing regular bedding cultures, if you're using reusable towels, to do those as well, and really be aware of the whole milk quality picture instead of just the cows that have clinical mastitis.
And those are all great tips there. Let's see if we have any other questions coming in from the viewers. So it looks like Lori was asking, what kind of volume of numbers per month would justify doing the on-farm culturing? And then what kind of ROI can a producer expect to see?
Well, and again, there's kind of averages. And so if you can probably get into an incubator for around a couple of $100. And you don't buy plates for one individual cow, but if you buy a stack of plates, those materials will end up costing about $3 per cow. And so use your own numbers. For some, they have a very low tolerance. They're very data driven, and they're always looking for those little ways to get a little bit better and to, again, treat fewer cows, make smarter decisions. And I go to farms. There's a lot of times where I walk into an office and the hospital tank is basically empty and the incubator's empty. There's nothing wrong with that. Having everything ready to go. It's having that equipment there when you need it and being able to use it. So that's going to vary quite a bit. So depending on how, it's like a lot of things. The cheaper you can buy your inputs, the faster your ROI is on it. It doesn't have to be fancy. And so I guess that would be kind of my generic way of answering that question. But the flip side would be if you're thinking about doing some of those monthly tests, you can't put 40 different cow samples in those typical inexpensive on-farm incubators either. So try to think of how you might use it before you go making any big decisions.
Yeah, definitely. That is great advice. And then I do see we have another question coming in from Becky. So she was wondering, as a small dairy goat herd, how are the plates stored before use, and how long are they good for prior to use?
They'll vary in wherever you get them. So the Minnesota Easy Culture ones that I'm used to working with and that you mentioned, Leslie, are some of the plates will have months before they expire, several months, up to 6 months, and some of them are going to be a matter of probably 3 to 4 weeks. And the expiration date, like a lot of other things, that's kind of a guideline, and the better you take care of them. So the things that you mentioned, Leslie, only taking out the ones that you need, putting the ones right back into the refrigerator. If you know that you're expecting a shipment,
Dr. Curt? So it looks like we may have lost Dr. Curt. I think he was just talking about having culture plates, if they get shipped to you, being able to get them right away. Don't let them sit out all day, 8 hours, outside in the heat. Get them in that refrigerator right away. And also storing them upside down. So the media is actually on the top side, and then the cap is underneath. So any moisture that collects, there wouldn't be any moisture collecting on the lid and dripping onto the plate. The one thing that you run into with older plates would happen to be if there was mold. So if you happen to take a plate out and you see that there is a growth of some sort on there, that plate then shouldn't be used. And then you can come back in and see what the other plates are looking like, or it might be time to renew and purchase new. But like Dr. Curt said, I mean, the plates expiration by the time you get them could be anywhere from the 3 to 4 weeks. And there's other brands that have more of that 6 months to 8 month expiration. Obviously, the ones that last longer are going to be more expensive up front, usually around the $7 a plate. Those would be like your AccuMast or your AccuStaff plates, whereas the Minnesota plates are well under half that. So it does look like we had lost Dr. Curt here, and he hasn't come back yet. So I do thank and very much appreciate him being on with us today. It does not look like we had any other questions come in. So if you are viewing this being recorded, feel free to type in any questions. We'll be able to answer them and get back to you. So with the recorded version, this is available on our Facebook page, YouTube channel, or on our website at www.armoranimalhealth.com/have-you-heard. And so, again, thank you for joining us. We do hope that you've learned something new. Remember to share this with your friends and continue on. It does look like we did get Dr. Curt back. So I was just doing our closing remarks here. I didn't know if you had anything else for our viewers to wrap up. I kind of finished up with how to, have the plates properly stored in the fridge and
Mhm.
kind of the different expiration dates.
Yeah, I apologize. Not sure what happened there, but no, thank you for asking me to join you this afternoon, and feel free to ask questions now, ask questions later, and if there's something that I can do to help follow up. But I guess just a couple of closing comments. I mean, this is again, there's so much potential to the value that this can have to a farm. Even those farms that feel like they've got a good handle on milk quality, the somatic cell count is low. Sometimes those are the best farms because you can see the immediate impacts, the results, and it doesn't seem like such a dramatic hill to climb. But for some of those farms that will see some spikes, this is a great aid to be able to treat the cows that need to be treated without overloading your hospital and spending a lot of money on treatments and frustrating your labor. So it's garbage in, garbage out. Do a great job with all the way from prepping the cow, collecting the sample, labeling the vial, labeling the plate, doing a good job in your lab, making things clean, and then recording the results, and then doing some of the validation that we talked about, so that you trust what you're doing and see the value in that as well. And in general, those farms are very happy with the investment of time and that little bit of money that it takes to get started.
Thank you very much. And like I said, we still don't have any additional questions coming in, so I think we're good for a nice intro on farm culturing. But we'll see all you viewers in 3 weeks on May 6th for the next episode of Have You Heard? And on that show, we'll be having Armour's very own veterinarians, Dr. Jacob Carlson and Megan Tiffany, along with our rep, Gabby, and they're going to be discussing pairing beef for the summer grazing period. So until next time, start culturing.